A mysterious outbreak among children here in the U.S. The CDC is saying that a sixth child has died from severe hepatitis, and 180 kids in the U.S. have been infected. That's since October. Most recovered, but 15 had needed organ transplants. Scientists are baffled and wonder if it could be linked to the coronavirus pandemic. Senior medical correspondent Dr. Narula spoke to one family that suddenly found themselves in a life or death situation with their little girl.
2-year-old Baylin Schwab may look healthy now, but just a few weeks ago, the South Dakota toddler's health took a sudden turn.
Her eyes looked a little bit yellow. We took her into the doctor, and all of her liver enzyme labs were extremely elevated.
Doctors told Baylin's mom her liver was inflamed. She was flown to M Health Fairview Masonic Children's Hospital in Minneapolis.
At that point, did they have any idea what might be going on?
For the first 3 days, we really had no clue what was happening. And then all of a sudden, the next day hit and kind of everything just went chaos. Her labs skyrocketed. Neurologically, she wasn't really 100% there. It was very hard. You see your kid deteriorating right in front of your eyes overnight.
Can I pick you up?
Baylin had severe hepatitis and her liver was failing. Dr. Srinath Chinnakotla is her doctor and has already performed a transplant this year on an even younger child.
We would do maybe one transplant for liver failure a year or maybe every other year. But this year we have already done 2 transplants for acute liver failure. So that's certainly a concern for us.
Baylin went to the top of the transplant list, and within days, a donor was found. After the 8-hour transplant surgery, doctors found that 90% of her removed liver was damaged tissue.
I'm actually thrilled with the entire progress.
Baylin is getting stronger every day, and that strength runs in the family. In December, the Schwabs had to pull together when their youngest, 11-month-old Laramie, died from sudden infant death syndrome. Everyone is anxious to have Baylin back home.
What does your older daughter understand about what has happened to her sister?
She was a little bit concerned because the last time she had a sister that went to the hospital, she didn't come home. So she's been really struggling with understanding what's going on.
How will you explain this to Baylin when she's old enough to understand?
I think she's defied all odds as far as recovery and how fast she's bouncing back. She honestly is an inspiration for me.
Baylin is still in the hospital. She's done remarkably well so far in her recovery, but will have to take anti-rejection medications for the rest of her life and be closely monitored for transplant rejection and the risks associated with the medications.
Boy, glad to hear she's doing well. It's a lot of suffering for one family.
Right.
And a lot of parents are going to be worried seeing that, wondering if it could happen in their family. So what are the symptoms they should be looking for?
Right. So let's first point out that this is extremely rare. And in the call that the CDC gave on Friday, they said that this is not yet considered a spike or an outbreak, but actually something notable is sort of how they put it. Most of the patients or the cases have recovered, right? So we want to kind of caveat all of this with that. That being said, parents should be aware that the median age is around 2. So this is really affecting young preschoolers. It's been seen in 36 states. And the symptoms would be nausea, vomiting, abdominal pain, fever, jaundice. So when the eyes or the skin look yellow, dark urine or light-colored stool, joint pain and fatigue. And if you see any of that, you definitely want to alert your pediatrician.
It's hard to see your children sick. What do you think caused it in the case?
That's really the big question. And so the CDC is going to have to kind of uncover this medical mystery in many of the same ways that they did, if you remember, with acute flaccid myelitis a couple of years ago. So it's putting together the medical records, exposures, lab data, what's happening around the world. At this point in time, the leading hypothesis is that there may be some association with adenovirus 41. This is a virus that typically causes a gastrointestinal illness in children, not usually hepatitis. But they're saying it's possible that there are a couple of things that could be happening. Number one, kids were not exposed to adenovirus that much in the last couple of years because of the mitigation strategies. So that may have affected how they're reacting to it now. It may be that adenovirus 41 in combination with another infection. So, for example, COVID, if they had been exposed to COVID, that may have primed their immune system in such a way that they're having a hyperimmune reaction. Maybe this is some other unusual strain or different strain of adenovirus. So a lot of leading hypotheses that they're investigating right now. And it's going to take a little time.
Yeah, Tara, thank you so much. We appreciate you. Great information. Good to see you again.